everyone. Today I'm in beautiful Colorado, mountains behind me. Got Ben Kacos on the phone today. And I wanted to have, it was important because this week I've had multiple people reach out to us saying, hey, our comp exams are down. What do we do? And I've been telling them, hey, people want to get into appointments through emergencies or hygiene. I mean, hygiene is critical in this market right now because that's where the demand is. People don't want to spend money to come to the dentist unless they're having something done. And what needs to be done is either a cleaning or if there's something, a toothache or something like that. So I got Ben on his Zoom because he is operationally great at converting new patients into either a cleaning or limited into a cleaning, or flipping people who are looking comps into cleaning. And so, or sorry, the way around, making sure that he has openings in his cleaning and not pushing people to comps. So Ben, tell us a little bit about what you are doing right now to make this work.
Yeah, so a lot of it has to do with one of the concepts that we call what's in it for them, right? So always trying to phrase questions are better than statements, but always trying to phrase questions in a way that guides them to a benefit for them as opposed to a benefit for you. So would you like a comp exam? That provides no benefit to them. Would you like to see if there's any other teeth that have issues that can be fixed before they start hurting while that part of your mouth is already numb from this tooth, right? So that provides a benefit to them. You could say, would you like to try if there's any other issues? They're easier, faster, and cheaper to fix the sooner you find out about them. And this area of your mouth is already going to be numb. Would you like to know if there's any other issues going on there? Then one of the things that we do a lot of is IV sedation. Maybe you're doing oral sedation. And then when we talk to folks about sedation, I'll say many of our patients choose to have all their work done at one time since they're already going to be taking a day off from work and they're going to be sedated. If you don't do sedation, you could still use the same type of technique and verbiage saying, you're already leaving work. Would you like to be most efficient with your time and take care of any other needs you may have so you don't have to leave work again, or so you can avoid further pain, money, and time in the future, right? So by flipping questions or statements into a what's in it for them scenario, I think that you're going to see much greater acceptance of the proposals.
Yeah, so Ben, one thing that's coming up is for practices who are bringing people through the comp side, and we're seeing this over and over again. They're just not, the demand is there, the calls are there, online conversions are there, but if they're bringing them through the comp, if they go to online scheduling or they set up a call or they call and say, hey, I'm a new patient, like, okay, we can get you in for a comp exam. Those conversion percentages we're seeing decrease by 30-40% at this point. What do you say to those practices who bring people through on that side of the schedule? What would you do for them?
I'm not sure I follow. So their hygiene, their new patient flow and hygiene is falling apart.
Well, no, on the comp side. So they're bringing people through the exam side and not through cleans because people want to have a hygiene. So so I guess let's just if I'm a new patient and I call you, and I'm looking.
So they're doing doctor side exams.
Correct, yes.
Oh, yeah. So one of our core tenets is always to be the second opinion. We always want the doctor to be the second opinion, sometimes a third opinion, and because when many patients come to the dentist, they believe that the dentist diagnoses issues based on their monthly payments, right? They've got a boat payment. That's the big joke, right? Maybe they had a slow month. They're going to diagnose more work. In reality, that's not true for the majority of us. Whereas if a hygienist or an assistant or AI tells them they have a problem, those are agnostic diagnoses. They don't think that there's any benefit for a hygienist, an assistant, or AI to make a diagnosis, so they're more apt to believe it, right? So we never want to be the first opinion in my office. We always want a hygienist or an assistant to make a diagnosis first. Now, we have a calibration system that we use to get everybody on the same page, which is really easy. All you do is get your insurance coordinator to take all the images that they're submitting for an insurance claim, intraoral photos, bite wings, PAs, CTs, all of those things, and get like 200 of those images, 200 different teeth, and you put them on a PowerPoint. And then you go through it with your team and you ask your team, what do you see? They're going to say, I see a huge cavity. Okay, great. How do you treat it? Well, you get everybody calling balls and strikes the same way. This is something that we do with all of our new employees. And this is something that we do as a full team at least once a quarter just to keep everybody calibrated. We'll just do a case review through lunch on the TV and make sure that everybody is pretty darn close, pretty darn calibrated on how to diagnose. The other thing that we've seen a great way to increase case acceptance by being the second or third opinion is by using AI. So we use Pearl in our practice, and the first thing I'll do is I'll say we use AI to help our patients see cavities. Pull it up on the TV. You see everything that's purple? That's where the AI has recognized the problem. And it's all about the AI. It's nothing to do with the doctor's opinion because computers don't have opinions. Computers only know facts, and computers are always right. So we try to push as much of that on the AI as possible.
Yeah, and one thing that you do, you, Addison, Bill Keith, Jason Tenuri, you guys get the patient in the door. And that's what I try to stress to people is when they're saying, hey, they're calling and I don't have a hygiene appointment available for 3 weeks. But your guys' mentality is get them in the door and get that appointment set up, because that's where we're seeing things fall apart is if you say, hey, I can't get you in for a cleaning for 4 weeks. Like, well, okay, I'll go somewhere else. You do some, you create a schedule that really, and when your conversion online or over the phone is so good, can you give a little insight on what you do from a phone training standpoint to turn those calls into new patients?
Well, our phone training is extensive. We have a 20-point grading scale that each of our phone calls gets graded on, and then we report every day. Every day in our morning huddle, we're going to report how many new patient phone calls did we get, how many scheduled, what was the average call score, and how many missed calls did we have. Every missed call is a missed opportunity. It could be an arch, it could be a veneer case, it could be a molar root canal buildup and crown, it could be a family. It doesn't matter. You don't want any missed calls. So we're staying dialed in on our verbiage and our ability to close cases. But I think these folks that are booked out, they've got to, the easy answer is hire another hygienist. I know you can't do that probably. So then what do? You've got to have a facility and a team that allows you to say yes. You've got to have more chairs than you need every day, and you've got to have more team members than you have to have every day, so that when somebody calls, you've got a room to put them in and then a team member to help get them treatment.
Yeah, I think that's the key is the fact that you make it happen. If someone wants to you get them in the door. And I know this isn't the purpose of this call, but you have a Peak Dental Resource course coming up, Total Hygiene, that's coming up here in a couple of weeks. And anybody that we work with, this is probably the best course that I think you offer. I mean, all of your courses are great, but this one is so critical because it turns those hygiene visits into production. And so can you talk a little bit about that course and what's going on with that?
Yeah, you're right. This is our most popular course. We're only offering it once this year. It's April 10th in Charlotte. It's priced to bring your whole hygiene team. It's designed for hygienists and doctors to get on the same page, to get educated, to get calibrated and motivated together so that you can support one another. You understand the modern diagnostic procedures, techniques that we're using. You understand the oral systemic connection. You learn how a hygienist can produce 4 and 5 times their pay. Now, all of my hygienists are producing over 3.3 times their pay. They always do. Whether they're right out of school or they're a 20-year veteran of another practice, once they get through our curriculum, get through our onboarding, then it's this huge paradigm shift. And they've got to have the education, they've got to be calibrated, and last and certainly not least is they've got to have a leader that understands what they're trying to do and supports them so that they're not scared to do something new. And so that course is April 10th in Charlotte. And if anybody's interested in it, you can go to my website, peakdentalresources.com. Peak like the mountains behind Ryan right now.
That's right. Well, and we've had about 24, I think, practices we worked with go through this course, and we're getting some early data. I haven't shared this with you, Ben, but we have seen anywhere on those practices that have gone to the course, see an increase of 5 to 15% or more on the production coming out of their hygiene. So it's significant, because what you're going to learn from this is really everything that Ben said. And I would love for every one of our practices to go to it, because it'll make more money. Everyone's happy that way. So I really encourage you to take a look at that. It's peakdentalresources.com. I'm going to send it out in this video as well, so you can get more information on that. And Ben's always open. Ben's a great guy. He will always answer any questions that you have. So I'll include his email contact in here, but reach out to him. But I hope this really helps answer the questions that we've been coming up, and really get more production out of the patients who are wanting to see you through cleanings. And we didn't even talk about emergency visits. That Ben is the king of emergency visits. That's a whole nother video that we need to do. I realize going for a walk on a Zoom call in the mountains when you're not used to it is also a little bit of a struggle. So,
well, at least you're not doing it from the back of your office in Shreveport.
That's true. So cool,
it feels
Ben.
good to sit down.
Yeah, cool, Ben. I appreciate it. And like I said, reach out to Ben if you have any questions about his course or just anything. He's a phenomenal resource. Peakdentalresource.com. Again, we'll send the link for that. But thank you again, Ben.
All right. Enjoy your vacation.
Thanks, man.
Later.
Bye.